What if I told you there's a blood disorder? Usually we think it's linked to vaccines or infections, but what if it could actually be like a chronic condition, just kind of lurking undetected?
Oh, that's a scary thought.
Yeah, so that's actually what we're diving into today.
Okay.
This groundbreaking study from the New England Journal of Medicine, February 12, 2025.
Wow, very recent.
Yeah, so it's about, get this, it's called VITT-like monoclonal gammopathy of thrombotic significance, or they shorten it to MGTS.
Catchy.
Yeah.
Very catchy.
So we've got the original article, obviously, but we also did some deep dives into all the references that it cites.
Nice.
So we're going to unpack this whole thing.
That's good.
So this deep dive is especially relevant if you're interested in, the latest on blood clots and how they're diagnosed, because this is like a whole new frontier.
It really does kind of change how we talk about some of these clotting disorders, going forward.
Right.
Yeah.
Okay, so to set the stage,
Okay.
let's talk about two conditions you've probably heard of, HIT-C and VIT.
Okay.
These both involve antibodies, the target platelet factor 4, or TF4, which is a protein that helps your blood clot normally.
Right.
But in HIT and VITT, these antibodies, they go rogue and they cause all sorts of problems.
Right. And the typical understanding is that they're acute and transient.
Okay, so what does that mean exactly?
So basically, they come on the suddenly.
Okay.
And they're usually triggered by a specific event.
Okay.
So, for example, HIT is usually triggered by heparin, which is a common blood thinner.
Right.
V, on the other hand, that's been linked to certain adenoviral vector vaccines, like some of the COVID-19 vaccines, or even infections with adenoviruses themselves.
Got it.
Yeah.
So they're like a hit-and-run situation.
Pretty much.
Something triggers them, they cause chaos for a bit.
Yeah.
But then they fade away within a few weeks.
Usually, yeah.
But that's not the case with MGTS.
No, not at all.
So MGTS is different because it appears to be a chronic condition.
Right. So those anti-PF4 antibodies, instead of disappearing, they just sort of hang around.
And cause all sorts of trouble.
Exactly.
That's what this study in the New England Journal is all about. They looked at 5 patients ranging in age from 35 to 79.
Okay. Wide range.
Yeah, and who all experienced these really unusual recurring blood clots.
Wow.
And get this, the clots weren't responding to the usual anticoagulant medications.
So the typical blood thinners weren't working.
Yeah.
Interesting.
And it's not just the recurrence that's unusual.
Right.
It's also the variety of locations where these clots were forming.
Oh, wow.
We're not just talking about the typical deep vein thrombosis or pulmonary embolism.
Okay, so where were they showing up?
Oh, it was like a clotting lottery.
Oh, no.
These patients had clots in their legs, lungs, liver, kidneys, spleen.
Oh, my goodness.
Even the brain.
Wow. So all over the place.
And this is where things get really interesting. The researchers discovered that all 5 of these MGTS patients had these low levels of something called M proteins in their blood.
Okay, now I'm not super familiar with M proteins. What are those?
So M proteins are basically abnormal antibodies produced by plasma cells in your bone marrow.
Okay.
So these M proteins are like antibody imposters.
Yeah, kind of. They're antibodies, but they're not doing their job properly. So what the researchers found, using a technique called mass spectrometry, is that these M proteins were actually the culprit anti-PF4 antibodies causing all the clotting problems.
Interesting. So now we've got like a suspect.
Right.
But here's another twist.
Okay.
Post-viral VFE patients, the ones who develop VIT after an adenovirus infection, they don't have these detectable M proteins.
So that's interesting. So how do those two things relate then?
Right. So that's one of the key differences that separates MGTS from acute VFT.
Okay.
It suggests that there's something fundamentally different about the antibodies involved.
Yeah, that makes sense.
So these MGTS antibodies are like the stealthy cousins of the VFE antibodies. They both target PF4, but the MGPS ones are linked to these M proteins, and they stick around causing trouble long after the initial trigger is gone.
Right, they're trying.
Right? And not only are they chronic, but they're also unique to each patient.
Oh, wow.
Think of it like each person's MGTS antibodies have their own individual fingerprints.
That's wild. But if they're all different, how can they all cause the same problem with clotting?
That is a great question, and the answer lies in the way they interact with PF4. So despite their unique fingerprints, both MGTS and VIT antibodies share a similar negatively charged region that binds to PF4, which is positively charged.
Okay.
It's like they're both using the same key to unlock the door to PF4, even though the keys themselves look different.
I see. So it's not just about what they target, but how they target it.
Exactly.
That's fascinating.
But it also makes me wonder, if these M protein levels are so low in MGTS, how do doctors even figure out that someone has it? I mean, it sounds like it could easily fly under the radar.
You're telling me?
Yeah.
Yeah, and that's one of the major challenges with diagnosing MGTS. These low M protein levels often fall below the thresholds that would typically trigger further investigation.
So it's like trying to find a needle in a haystack.
Yeah, but with potentially life-threatening consequences? It really highlights the need for, greater awareness and specialized testing.
So those standard rapid assays that are used to detect hit antibodies, they completely miss MGTS.
Yeah, they miss it completely.
So what kind of testing is needed to catch MGTS?
So we're talking about more specialized tests like PF4-dependent ELISAs and washed platelet activation assays.
Okay.
These tests are specifically designed to detect the types of heparin-independent antibodies that are characteristic of MGTS.
So it's not as simple as just running a routine blood test.
No, it's definitely more specialized.
It requires more specialized labs and a higher level of suspicion from the clinician.
Yeah, absolutely.
And even when those tests are done, it's crucial to confirm that the antibodies are persistent for at least 3 months.
Right.
Remember, MGTS is a chronic condition, so we need to make sure we're not just catching a transient blip.
Yeah, that's a good point.
Okay, so we've got this rare chronic condition
Yes.
that's hard to diagnose, and it causes all sorts of blood clots.
Uh-huh.
What's the next step? What can be done to help these patients? Is it a lifetime of blood thinners?
Well, you would think so, but traditional anticoagulants alone aren't enough to manage MGTF. Those persistent antibodies, those are the root of the problem.
So it's like putting a Band-Aid on a wound that keeps getting re-injured.
Yes, exactly.
We need to tackle the source of the problem.
Yes.
So what are the options?
Well, the NEGM study explores some alternative treatment strategies, and this is where the story gets really interesting.
Okay, I'm all ears. Tell me there's some light at the end of this tunnel.
Well, there are definitely some promising avenues.
There are definitely some promising avenues. So one option is high-dose IVIG,
Okay.
which is intravenous immunoglobulin.
Right.
This treatment is already used for VITT,
Okay.
and it basically works by flooding the body with healthy antibodies, which can help to block those rogue anti-PF4 antibodies from wreaking havoc.
So it's like creating a distraction or a smoke screen to protect those platelets from being attacked.
That's a good analogy. And in some of the MGTS patients in the study, IVIG did lead to an increase in platelet counts,
Okay.
which is a good sign.
Yeah, for sure.
But did it actually stop the clots from forming?
That's where things get a little more complicated. While IVIG might offer some temporary relief, it doesn't address the root cause,
Okay.
which is those persistent M protein antibodies that keep churning out those harmful antibodies.
Right. It's like a temporary fix, not a permanent solution.
Exactly. And that's why the study also explored some more targeted therapies like Bruton tyrosine kinase inhibitors, or BTK inhibitors for short.
Okay, those are the ones that sounded like something out of a science fiction movie.
They do have a rather futuristic ring to them, don't they?
They do?
But they're based on some solid science, so BTK inhibitors like ibrutinib work by inhibiting specific signaling pathways that are involved in the activation of platelets.
Okay.
And remember those pesky FC receptors we talked about earlier?
Uh-huh.
They play a key role in this whole clotting cascade.
Right, those FC receptors are like the communication hub, relaying messages between the antibodies and the platelets.
Precisely. So by shutting down those communication lines with a BTK inhibitor, you can effectively disrupt the clotting process.
Wow, so it's like cutting the wires on a bomb. That's pretty powerful stuff. Did any of the MGTS patients in the study benefit from these BTK inhibitors?
There was one patient, patient 1, who experienced a significant improvement after being treated with ibrutinib.
Okay.
So it's definitely a potential weapon in the arsenal against MGTS.
That's good to hear. But what about those plasma cell-directed myeloma therapies? Those sounded like the most aggressive option. How do those work?
So myeloma therapies are designed to target and eliminate the very cells that are producing those M proteins in the first place.
So it's like taking out the antibody factory at its sword. But wait, aren't those therapies usually used for cancer?
You're absolutely right. These therapies are typically used to treat multiple myeloma, which is a cancer of the plasma cells. But remember, in MGTS, those plasma cells are going rogue and producing these harmful anti-PF4 antibodies, even though the patients don't have full-blown myeloma.
So it's like borrowing a tool from the cancer treatment toolbox to address this unique clotting disorder. That's pretty ingenious. But did it actually work for any of the MGT patients?
The study actually showed some remarkable results with this approach. Patient 3, who received a combination of bortezomib, cyclophosphamide, and daratumumab, experienced complete elimination of the M protein and the troublesome antibodies.
Wait, complete elimination? That's incredible. So they essentially cured this patient of MGTS.
Well, cure is a strong word, but they did achieve complete remission. This patient remained free of blood clots for a full year after starting the treatment. So there's definitely hope for MGTS patients, even though it's a challenging condition to diagnose and treat.
Those are some truly amazing results. But I imagine that each patient's case is unique, and what works for one person might not work for another.
You're absolutely right, and that's why the authors of this study are urging the medical community to start testing for anti-PF4 antibodies and M proteins in patients with unexplained chronic blood clots.
That makes perfect sense. If we can identify more cases of MGTS, we can start to learn more about it and figure out the best ways to treat it.
Exactly. And if we consider that 5 out of the 6 patients who were referred to the specialized labs in this study ended up having MGTS, it suggests that this condition could be more common than we realize.
Wow, 5 out of 6. That's a pretty significant number. It makes you wonder how many cases of MGTS might be out there, hidden in plain sight because they're being misdiagnosed as something else.
That's a very real possibility, and that's why raising awareness about this condition is so important. Early diagnosis and appropriate treatment could make a world of difference for these patients.
This whole conversation has been incredibly eye-opening. We've gone from what seemed like a rare side effect to a potential hidden epidemic of chronic blood clots.
It really underscores the fact that the world of medicine is constantly evolving, and there's always something new to discover.
Absolutely. This is definitely a deep dive that will have me thinking differently about blood clots and the importance of staying informed about the latest medical advancements.
I agree. Knowledge is power, especially when it comes to our health.
Well, we've covered a lot of ground in this second part of our deep dive, but there's still so much more to explore. Stay tuned for part 3, where we'll delve even deeper into the implications of this groundbreaking study and what it means for the future of blood clot research and treatment. You know, it's crazy to think that just a few years ago, we didn't even know MGTS existed.
Yeah, it really shows how much there still is to learn about blood clots and, how they work.
Yeah, absolutely. So as we wrap up our deep dive into MGTS, I think it's worth highlighting some of those key takeaways for our listeners.
Yeah, definitely. So, first and foremost, I think the big one is that specialized testing for those anti-PF4 antibodies is really crucial for anyone who has unexplained blood clots, especially those who have chronic or recurring ones.
Right, because those are often like the red flags for MGTS.
Yeah, exactly. And we know those standard rapid tests that are typically used for HIT, those just aren't going to cut it for MGTF.
They're just not designed to detect the right type of antibodies.
Right. They're looking for antibodies that are, enhanced by heparin, but in MGTS, those antibodies, they're heparin independent.
So we need those more specialized tests, like those PS4-dependent ELISAs or those wash platelet activation assays.
Yeah, those are the ones that can actually pinpoint MGTS.
So I guess the question then is, how do we make sure those tests are more readily available? And how do we make sure doctors are even aware of MGTS and its unique, diagnostic requirements?
That's a great question. And honestly, it comes down to awareness. We need to educate healthcare professionals about MGTS, what it looks like, how it presents, and really emphasize the importance of considering it as a possibility when they're faced with a patient who has those unexplained clots, especially if they keep coming back.
Right. It's like you need to know what you're looking for in order to even, think to test for it.
Absolutely. And the sooner we can catch those MGTS signals, the better chance we have of preventing some of those serious complications like strokes, pulmonary embolisms, even death.
It's not just about diagnosis. It's about saving lives, potentially.
Exactly. Early intervention is key.
Okay, so we've talked about diagnosis, but what about treatment? What does the future hold for MGTS treatment?
Well, I think this is where things get really exciting, because this NEGM study has really opened up a whole new world of possibilities.
It's shown us that there are some really effective treatments out there, even beyond those traditional blood thinners.
Right. We talked about IVIG, those BTK inhibitors, even those myeloma therapies.
Yeah, and the study showed some pretty incredible results with those approaches, especially with patient 1 and that BTK inhibitor, ibrutinib, and then, of course, patient 3, who achieved complete remission with a myeloma therapy.
Yeah, absolutely. And that's just from, this initial study.
It definitely gives a lot of hope for the future of MGTS treatment.
Definitely. But of course, we still need more research. We need to figure out which treatments work best for which patients, what the right dosages are, how to manage any potential side effects, all of that.
It's about, tailoring treatment to the individual.
Exactly. Personalized medicine.
This whole conversation has been so eye-opening. I mean, it's incredible how much we've learned about MGTS in just, a few years?
Yeah, it's a testament to all those researchers out there who are working tirelessly to, understand and treat these complex conditions.
It really highlights the power of, medical research and how important it is to never stop questioning and exploring new avenues.
And never lose hope, because with each new discovery, we get closer to a future where these conditions that once seemed so mysterious and difficult to treat can be managed effectively.
It's a future where patients can live healthier lives.
Absolutely.
Well, that's a fantastic note to end on.
Yeah, it is.
Thank you so much for joining us on this deep dive into MGTS. It's been truly enlightening.
It's been my pleasure.
And to our listeners, if you've ever experienced those unexplained or recurring blood clots, please talk to your doctor about MGTS. Ask about those specialized tests. It's better to be safe than sorry, and early detection can make a world of difference.
Absolutely.
So, until next time, stay curious and stay informed.